Hello, in this video we are continuing the focus on sleep, and in particular I'm going to be talking about various mind-body therapies for sleep. I find it particularly useful when talking to my patients and also telling you that it is better to think about this in a holistic concept of what is called sleep hygiene. Now, it is very much similar to the other places that we hear the term hygiene mentioned, is that we are talking about a series of things that you do as a routine which will enable you to have a consistent sleep pattern and, more importantly, develop a habit that can then last through a lifetime. We all understand that life gets in its way and we will have disturbed phases for a variety of reasons when sleep gets disturbed. But if we do have a good sleep hygiene, then it will not be difficult for us to get back into the swing of things. So what constitutes sleep hygiene? Now, the American Sleep Foundation has given a very good booklet or a PDF of what constitutes the various steps in sleep hygiene, and I will put that in the resources for you to have a look at. But the main focus of sleep hygiene is to ensure that there is a routine, and components of this routine will ensure that you have a good amount of physical activity. You avoid trying to have any long naps during the daytime. Ensure in terms of food and how much or when you have the food before you go to bed, and carbohydrate loading in terms of your dinner time or lunch time. All of this has a pattern to play in. The other thing is the aim of ensuring that you reduce your lighting and almost prepare your nervous system for relaxing and calming down. So a quieter environment, a cooler environment, having a warm bath, having some kind of ritual that you can start in terms of reading, and ensuring that bright lights or blue light is not necessarily present in your sleep environment. These are important things to think about. Digital detox is becoming a very relevant aspect to think about, and there is a suggestion that you should bring down all digital equipment at least 90 minutes before bedtime. Try to avoid any electronic that bring about blue light, because blue light can reduce the amount of melatonin which is required in bringing about sleep. So this is all part and element of sleep hygiene. There may be a role for medications, but what is most important these days, and in fact is very evidence-based, is the use of specific mind-body therapies like mindfulness, and more specifically CBT, which is cognitive behavioral therapy for insomnia. In fact, there is an app that has been now approved for the first time by the NHS as a prescription for sleep, and it's an app called Sleepyo, which I mentioned in my book as well. But at the time of making this video, Sleepyo has been the first app that's been offered on prescription, and it essentially takes the principle of CBT based approach to improving your sleep, and this, when you combine it with other routines, becomes a very necessary part of good sleep hygiene. Thank you.